Broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Thank you for joining us for our state health plan update, as I will be providing information for employers. My name is Joy Roberson. I am a customer experience specialist here at the state health plan, and I will be facilitating today's webinar as well as the presentation for those of you here in the room. If you have any questions during the course of this webinar, please feel free to post those in the questions box in the GoToWebinar toolbar there, and we will address all of your questions at the end of the presentation. There is a PDF copy of this presentation in the handouts portion of the toolbar there. So if you want to open that, download it, save it for later, or follow along, you may certainly do that as well. So we have reserved this webinar for a 3-hour time span, so we can go into as much detail as you guys would like to on any of the subjects that will be covered today. Without further ado, we'll go ahead and get started. All right, so on our agenda today, we will be discussing the Clear Pricing Project, as well as employer resources, enrollment process for new hires, qualifying life events or QLEs, the open enrollment that's coming up, which will be held November 2nd through November 19th, rehired retirees, as well as the 2020 plan options for retirees, retirement enrollment, and other important information that you may find useful. The Clear Pricing Project. So, the goal of the Clear Pricing Project was to ensure that members have this valuable benefit for years to come. It is only applicable to the 70-30 plan in terms of retirees. The Clear Pricing Project was developed to secure the state health plan's financial future. The goal was to ensure that members have this benefit for years to come while bringing transparency to healthcare costs and address the rising health costs that plan members face. This effort resulted in more than 25,000 providers partnering with the plan, in addition to the in-network providers under the Blue Options Network administered by Blue Cross Blue Shield of North Carolina. However, no major hospitals were willing to partner with the plan. So to ensure that the state health plan members have access to a broad statewide network, the decision was made that members will continue to have access to the same network available as today. The Blue Options Network is administered by Blue Cross, as I mentioned before, in addition to those providers that are committed to transparent pricing. So basically what this means is that any providers that are currently in network today will remain in network as of 1/1/2020. In addition to those Blue Options Network providers, there are state health plan providers, that 25,000 providers there. They are also in network with your state health plan. So essentially, you ended up with more providers to take care of your medical needs. Here is what state health plan members need to know. For 2020, again, the network will be the same, and it's that same broad network that's administered by Blue Cross. Because of the success of the Clear Pricing Project, there will be even more providers. And as a reminder, this does not affect any members who are enrolled on the United Healthcare Medicare Advantage plans. So any Medicare primary retirees who are enrolled in either one of the United Healthcare plans, this does not impact them at all. So now we'll take a look at employer resources. Online resources include the state health plan website. I'm always suggesting that HBRs go out and use the state health plan website, as it is an extremely valuable resource to help you get through your daily tasks as they relate to the state health plan. Once you get to the website on the home page, there are a series of links across the top of the page. Click the HBRs tab, and that section of the website is dedicated to employing units and HBRs. You may also sign up to receive the e-newsletter for HBR updates as well as HBR alerts. HBR updates provide you with a monthly subscription to the e-newsletter, and it just contains information that you will find useful, general information, new things that are coming, and things of that nature. HBR alerts are also sent to you on an as-needed basis through that same distribution list. So if there's anything urgent that takes place, any legislative changes that you all need to know about that impact the state health plan, you will receive an alert through those channels there. Additionally, on the HBR's tab of the website, what you see on the screen here are the different sections that provide you with resources to get you through your day. So you have enrollment information as well as the exceptions process. A section of the HBR tab that I am particularly fond of is the training and development page. That page is chock full of resources, guides, step-by-step guides, and things of that nature to help you assist your employees with their questions that they may have about the state health plan. It also contains guides that are tailored to get you through navigating e-benefits. There are presentations there. There is a link to archived webinars there that you will find extremely useful. So I definitely encourage you to go out and take a look at that training and development section, as well as the entire HBR section as a whole. Additionally, something else that is very important on that page is the contact information for HBRs, and that's the green box at the bottom right hand corner there. That list contains resources and contact information for HBRs for all of the vendors. If you are confused about who you need to contact, if you need additional assistance with something, it's all listed right there. Phone numbers as well as some email addresses that you can use to access those resources and to get additional help if needed. HBR University. I am extremely proud of HBR University. It is our way to show our commitment to providing HBRs with the training that they need to best serve their employees. It is an online learning management tool. It's powered by SkyPrep. It contains job aids, trainings, mandatory trainings, things of that nature that also will help you get through your duties as they relate to the plan. You aren't limited to accessing HBR University from your workspace. You can access it online anywhere at any time at your own convenience. It does contain a growing library of trainings. We're currently working on additional trainings to provide as well as resources. Since open enrollment is coming up, and I will touch on open enrollment a little bit later during the presentation, HBR University will contain a dedicated section in its resource center that includes an open enrollment toolkit that will have presentations, screenshots, job aids, things of that nature, all of the open enrollment webinars. Once I complete those, I believe the last webinar is scheduled for September 20th. That presentation will be loaded into HBR University and the Resource Center, so you can go back and refer to it if you need to do that. The link to HBR University is here on your screen. However, you can also find this link on the training and development section in the additional resources box under that HBR tab on the website. So if you aren't familiar with HBR University and would like to become familiar with it, I definitely encourage you to go out and register and enroll in a few courses. So now we'll move along to new hire enrollment. So when can a new hire enroll? As an HBR, the expectation is that you add newly eligible employees into the e-benefits system, so those employees have the ability to log in and enroll in their benefits. They have 30 days from the date of their hire, from their hire date, to go in and enroll in their benefits, and they have an option of the effective date of their coverage. They can choose the first of the month following their hire date or the first of the second month following their hire date. In the example below, the employee was hired on October 15th. They would have until November 14th to elect coverage, and their effective date could be November 1st or December 1st. It is the employee's choice. We do ask that you refer your new employees to the new employee resources center. So again, across the top of the state health plan homepage, within those links, you will see new employee resources, I believe is what the link is entitled. Once you click there, there will be multiple materials that will help you in getting your new hires oriented and acclimated with the state health plan. So some of those resources do include the new employee resource center, the enrollment kit, narrated presentation, as well as a how to enroll video. So there's also a message from the treasurer that is very helpful. Just lots of resources available there just by visiting www.shpnc.org. Employees that do not enroll within 30 days of their hire date will not be able to enroll until the open enrollment period. So it's extremely important that you make sure that your new hires are aware that they need to enroll within those 30 days. Something else that I'd like to talk about since we're on enrollment of new employees, the expectation is that you set up their account in eBenefits and provide them with their login information so the employee can go in and elect their own benefits. It is extremely frowned upon for you to go in and elect benefits for your employees. It happens. We see it a lot. And it causes quite a few problems. So when you go in and enroll an employee in their benefits, they do not get the opportunity to complete the tobacco attestation question. And in doing so, they miss out on that $60 credit. Then at that point, they will more than likely come to you and ask you to submit an exception for them. It will all depend on how the wind blows and how that will work out. So if there are extenuating circumstances and that employee misses that 30-day enrollment window, you may submit an exception. However, there should be an exceptionally good reason as to why they did not enroll. So 2 things there. Make sure that your employees enroll themselves and make sure they enroll within 30 days. If your employees do not have the means to enroll online using the e-benefits platform, which is a self-service system, they may call the Eligibility and Enrollment Center, and they will be more than happy to assist. So let's say your employee does log in, they begin to enroll, and they run into some technical issues. They may call the Enrollment and Eligibility Call Center, and someone will walk them through what to do next. But under no circumstances should you enroll your employees. It just creates a huge headache for everyone involved, and most importantly, our members, because they don't get their benefits up and running in a timely fashion. Qualifying life events. Qualifying life events, or QLEs as they are so affectionately called, allow members to make certain changes, such as adding or dropping dependents, and such as adding or dropping dependents, but they cannot change their plan. So let's say you have an employee who has recently gotten married, they want to add their spouse. They could certainly do that, but they cannot go from the 80-20 plan to the 70-30 plan because they are adding that spouse. Election changes must be consistent with the event as defined by the IRS. That is Section 125 of the Internal Revenue Code. All of that is listed on the State Health Plan website for your convenience. QLEs include, just a few examples, would be marriage, birth, spouse employment changes, divorce, things of that nature. A complete list of qualifying life events may be found in the benefits booklet on the plan's website. So once you go to www.shpnc.org, click the employee benefits link at the top of the page. And on that page, you would click the corresponding benefit plan that you are enrolled in to access your benefit booklet. The QLEs are listed in each benefit booklet, so it really doesn't matter which one you use. However, I would recommend choosing the benefit booklet that corresponds to the plan that you're enrolled in. Once you get into that document, you can click through the table of contents to find qualifying life events, or you can do a Control F search of the PDF document, enter in qualifying, and it should typically come up for you. But the list is there. It goes into detail of what constitutes a qualifying life event. Oftentimes, employees aren't sure if they're experiencing a QLE, and they may come to you for assistance with that. Please refer them to that benefits booklet. It's a valuable resource that unfortunately a lot of members don't even realize that they have. A lot of their questions can be answered just by reading that booklet. And again, changes must be made within 30 days of that qualifying life event, and documentation must be uploaded into eBenefits for the HBR to confirm that status change. So dependent verification documentation is extremely important. That documentation must be uploaded into eBenefits for the HBR to review to make sure that it is consistent with the QLE as defined by the IRS. We don't want to cover individuals who basically aren't eligible for coverage under the plan. So that is the entire purpose of having that documentation uploaded. There is a full list of QLE supporting documentation that is acceptable to be uploaded to support any qualifying life events that have been entered into eBenefits. That list is subject to change, so I would suggest that you access it directly from the website. It may not be a good idea to bookmark it because, again, it does change. And if you bookmark it, go back to it later, and there's been a change to it, you will miss out on that. So when I first started here, I started here last year, this documentation list was only 2 pages long. It is now 8 pages long, and that is because it lists all of the documents that are acceptable, as well as include some images of what is not acceptable and images of what is acceptable. A lot of times we do have some members that feel as though the documentation they provided is sufficient when in reality is not. And instead of doing all the back and forth with the HBR and then the HBR coming back to the state health plan saying, hey, is this sufficient? You can go out to this list and kind of compare what the employee has uploaded just to make sure. Occasionally, we do get a few circumstances that are kind of outside of the norm. So in those circumstances, feel free to definitely reach out to the plan if you need to, or reach out to the or account management team or the HBR support line, and they should be able to provide assistance with that as well. So again, dependent verification documentation is required for all dependents. There are no exceptions to that rule. It is the HBR's responsibility to ensure that proper documentation is uploaded for all new dependents, including dependents added during open enrollment. So, while it is your responsibility, the expectation is that members go in, log into eBenefits, and upload those documents themselves. However, we do understand that not everyone has the ability to scan a document or the equipment needed to scan a document and upload it. There are a few other resources that they can use. For example, the Benefit Focus has an app that I believe allows members to snap a picture of said documentation and upload it from your cell phone or any other mobile device. So that is also an option. If you have an employee to come into your office and say, hey, I got married, here's my marriage certificate and our bill showing joint tenancy or something like that, I don't have the means to upload this, could you do it for me? That is perfectly okay. But under no circumstances should you enter that QLE for them. They should log in and enter that QLE themselves. If they don't log in and do it themselves, they should call the Eligibility and Support Center and they will do it for them. Then they can come back to you and say, here are those documents. Can you assist me with that? Again, a full list of documents is located on the plan's website. Documents are to be uploaded and stored in eBenefits. And again, you may contact HBR support at Benefit Focus or your account manager directly if you need assistance. So now we'll move along to rehired retirees. In adherence to General Statute 13548.40, a retiree employed full-time, that's non-permanent or permanent, under an employing unit is no longer eligible for health coverage under the retirement system. There can be no dual coverage. So with that being said, the retirement system's coverage must be terminated in order for that retiree to go back to the active employing unit and have coverage under the active group. The employing unit is responsible for paying the employer premiums. Employees are considered full-time and required to be offered employer-sponsored health care if they are reasonably expected to work 30 hours a week. Permanent rehired retirees are eligible for the traditional plans, which would be the 70-30 and the 80-20 plans. Those rehired retirees, even if they're Medicare eligible, they would not be able to take advantage of the United Healthcare plans, simply because they are in an active work status. Effective January 1st of 16, employing units had the option to offer non-permanent full-time rehired retirees the HDHP or the high deductible health plan, as well as those traditional health plans. So while we're on the topic of rehired retirees, let's discuss Senate Bill 399 and its impact on rehired retirees. So over the summer, this bill was ratified, and it does allow retired teachers to return to work in high-need schools without adversely impacting their retired teachers' benefits. Retirees returning to work in a high-need school must cancel their retiree health benefit and enroll in health benefits through their employer. In order to do that, the termination of the state retirement system health benefits must be completed. Prior to the hire date, the HBR should notify the state health plan of the need to terminate those benefits by completing an exception. If you're not familiar with how to complete an exception, it is located under the HBR's tab under the plan's website. Upon approval of that exception to terminate the retiree health benefits, the HBR would then establish an active benefit enrollment shell and e-benefits that will enable that retiree to enroll in benefits under their active group. So basically, you submit an exception, you wait on the approval. Once that retirement system health benefit has been terminated, then you would create an active employee shell and allow that retiree to enroll into their benefits. The retiree will not be able to enroll under the retiree health benefit until the retiree health benefit has been canceled. And that is just a procedure in place that we have to prevent dual enrollment. We don't want state health plan members to be enrolled on both the retirement system as well as the active group. Another point that I want to make is that once the retiree has completed their employment with the high need school, their coverage should be terminated as a termination, just a regular termination. You would not do a retirement because technically that employee had already retired. They had just come back to work. So what you will need to do is to enter that termination as an termination. Once that termination is complete, that retiree will be able to re-enroll into their retiree benefits using the loss of other coverage QLE that is located in the reason code drop down in e-benefits. All right, so now we're going to move along to state health plan options. The state health plan offers two preferred provider organization or PPO plans for non-Medicare members. That would be the 80-20 plan and the 70-30 plan. Just as their titles suggest, the 80-20 plan pays 80% for most in-network services, while the 70-30 plan pays 70%. Medicare primary members, which would be those who are retired, do have the option of three plans. Two plans that are administered by the United Healthcare. Those are Medicare Advantage plans. One is a base plan, which is premium fee free. The other is an enhanced plan, which does carry a premium. And then there's also the 70/30 plan, which is administered by Blue Cross Blue Shield of North Carolina. All three plans include prescription drug coverage, so a separate Medicare prescription drug plan or a Medicare Part D plan is not necessary. All right. So on the next slide, we have enrollment. So what you see here is a slide that goes into the contribution status of state health plan retirees. If you were hired before October 1st, 2006, and you have five years of service, a non-contributory plan, you would pay $0 premium for the 70/30 plan. Of course, a partial contribution may be required for any other plan options. If you are hired on or after October 1st, 2006, and you have between 5 and 10 years of service, you would pay 100% of the premium. Between 10 and 20 years of service, you would pay 50% of the premium. And 20 years of service or more, you would have a $0 premium. I do want to point out that members will be auto-enrolled into a plan regardless of their contribution status. This does not dictate your eligibility for a retirement plan. This is simply providing a guide as to how much you're going to pay in your premium for your retiree plan. The auto-enrollment process is something else that is extremely important, as we do have some members who maybe decline state health plan coverage for their entire tenure of service. And once they have retired, they will be auto-enrolled into a plan regardless. If they do not want the coverage, they would need to opt out during the retirement process by calling 855-859-0966 or by logging in online.
And they're re-enrolled in the same plan they're already in, correct?
Yes. Yes, the question was, would the employee that's auto-enrolled be enrolled into the same plan that they were in during their active employment? So now we have retirement and the health plan effective date. The first month of retirement, the member remains covered under their active agency. So there are two important dates that you should be aware of, and that would be your retirement effective date as well as your health plan benefit effective date. The retirement date is the first of the month after you have stopped actively working, while the state health plan benefit effective date is the first of the month following your retirement effective date. There is sometimes some confusion there, and a lot of times people tend to use those dates somewhat interchangeably, and it only adds to the confusion. So it's very important to remember that the retirement date is the first of the month after you have stopped actively working, and the state health plan benefit effective date is the first of the month following the retirement effective date. The first month of your retirement, the retiree remains covered under their active agency. However, if you are Medicare eligible when you retire, Medicare is primary during that first month of retirement, and the coverage under the active agency would be secondary to Medicare. So it's extremely important that you understand that Medicare will become primary that first month, and they will need to have coverage in place, that Medicare coverage in place. It is important to have Medicare Part A and Part B in effect as of the retirement date. So for an example, let's say you stop working on December 20th. Your retirement effective date will be January 1, while your state health plan retirement benefit effective date would be February 1. If you are Medicare eligible, you will need to have Part A and Part B active and ready to go as of January 1. Otherwise, your claims will process under the phenomenon known as Phantom B claims processing, and it will just be a huge claims nightmare. So please make sure that employees understand that if they are Medicare eligible, they need to have their Medicare Parts A and B active as of the retirement effective date. And that's that last day, that last month that they are covered under the active plan, active group rather. So what we have here is regarding members who are under 65 and are retiring. So for members who will be under 65 at the time of retirement, it is recommended that they speak with their HR department and begin the retirement process through Orbit online or by submitting the retirement paperwork to the state retirement systems as timely as possible. You cannot submit them any earlier than 120 days before the anticipated retirement date. Once the state retirement system has reviewed and approved retirement, they will notify the state health plan's eligibility and enrollment support center of that eligibility for retiree coverage. The state health plan, that's where we come in, we will then auto-enroll the retiree into the same plan as they had as an active employee, which was what the statement you made just a moment ago, along with any dependents. The dependents will come along as well. It's important to note, again, that this auto-enrollment will occur whether the member was or was not enrolled in the state health plan as an active employee. If you're not enrolled as an active employee, then the retiree will be auto-enrolled into the 70/30 plan. So if you have declined state health plan coverage while you were an active employee with your group and you retire, once you retire, you will be auto-enrolled into the 70/30 plan. So it's very important to let your employees know about that when they come to have those discussions with you. And they're saying, well, I've put in X amount of years. I think it's time for me to hang up the jersey. I'm going to go ahead and retire. Make sure that they are aware that if they did not have coverage as an active employee, that they will still be auto-enrolled. Coming from Blue Cross Blue Shield and working on the state health plan account, I have seen numerous escalations where a retiree was not aware of this. They threatened to sue. You can't do this. It's illegal. I didn't sign any paperwork. Who authorized you to do that? Yeah, well, we kind of can do that. So we can do it. So just make sure that those retiring employees, when you're having those retirement conversations with them, they are aware of this. Now, they may opt out of the state health plan by calling Eligibility and Enrollment Center, or they can do it through Orbit. So they do have an option there. So perhaps you will be one of the employees or retirees who continue to I'm sorry, not a retiree, an employee who continues to work for the state beyond age 65. In this situation, the employee will receive a letter from the state health plan concerning their becoming Medicare eligible as a result of turning 65. Please note that the state health plan will continue to be their primary coverage and Medicare will be secondary as long as that employee is still actively working for the state. So when you are Medicare eligible, Medicare will be secondary as long as they're still working. We will recommend enrolling in Medicare Part A, but to delay enrollment into Medicare Part B. And the reason why is because enrolling in Medicare Part B typically requires that that employee pay a monthly premium to the federal government, while Medicare Part A is typically free if you have worked 10 years or more and paid FICA taxes. However, there is a caveat to that. And it's extremely important to remember that when you decide to retire, that when an employee decides to retire, they must enroll in Medicare Part B so it becomes effective the date of the planned retirement. They will have to contact the Social Security Administration to enroll in Medicare Part B. That is not something that is handled by the state health plan. I've seen some cases here recently where we had some retirees thinking that we had our hands in the enrollment in Medicare Part B or what have you, when in actuality we do not. That is a federal benefit that is administered through the federal government. So just make sure that employees are aware that that's what they will need to do. Unfortunately, some individuals cannot enroll online for just Medicare Part B. They will have to complete a form CMS S40B, and you as the employer will need to complete a form CMS L564 to verify that they have been actively working and covered under an employer group health plan that was primary to Medicare. These forms are available for download on the Social Security website, or that employee may call the Social Security office to have them mailed to them. Once completed, they will need to mail or hand carry the forms to their local Social Security field office. Another important note: Medicare Part B needs to become effective as of the anticipated retirement date. I know I've said that about 4 or 5 times already, guys, but that's just how important that is. The following slides are examples of those two forms. Okay, well, maybe it's not. My apologies. So Medicare primary and new retirees. What plan will they be auto-enrolled into if they are 65 or older? Well, this depends upon when their state retirement paperwork is processed and approved. If the paperwork is processed and approved by the state retirement system at least 60 days prior to the retiree state health plan benefit effective date, then they will be auto-enrolled into the United Healthcare Group Medicare Advantage base plan, not the enhanced plan. They'll be in the base plan. They will have the opportunity to make another election of any of the Medicare primary options up until 30 days before the retiree state health plan benefit effective date. So again, what you see on your screen here is another example that the state health plan benefit effective date is the first of the month following the retirement effective date. So if the retirement date is January 1, the state health plan benefit effective date is February 1. What we have on this screen here is for Medicare primary new retirees. And what if they cannot plan their retirement and they submit their state retirement paperwork late? So this would be that situation where you have an individual who just walks into the office and you say, you know what, I've had about enough of all of y'all. I am going to retire. I'm about to submit my paperwork. I know it's not within that time frame. It's going to be less than that 60 days. And you know, they're just throwing their hands up and they are done. So if their retirement paperwork is processed and approved less than 60 days before the retiree state health plan benefit effective date, they will be auto-enrolled into the 70/30 PPO plan. If this occurs, though, they will have the opportunity to enroll in one of the United Healthcare Group Medicare Advantage plans up until the day before that state health plan benefit effective date. So they have up until the day before to make that option if that paperwork is processed and approved less than 60 days. So just keep that in mind. All right, so the enrollment guidelines for families. Medicare primary family members are to stay together. So if the plan subscriber is Medicare primary, as well as their Medicare eligible covered spouse or dependents, the group Medicare Advantage plan selected by the plan subscriber will also be the chosen plan for their Medicare primary covered spouse or dependents. Medicare primary family members will stay together unless they are a split age family, meaning the subscriber is over 65 and enrolled in one of the Medicare Advantage plans, and the spouse or dependents is under 65 and covered by the state health plan under one of the traditional policies. In the situation where the plan subscriber is the only one who is Medicare primary and has a spouse or dependents covered by the plan, then the covered spouse and or dependents will have the same options available to active employees or non-Medicare primary members. So basically what this means is that if the subscriber is Medicare eligible, they could be on a United Healthcare base plan. The children that they may cover as dependents, they still have the options of the 80/20 and the 70/30 plan because they are not Medicare eligible. So that's basically what that all boils down to there. Another situation where there may be a split age is if the subscriber is retired but under 65 and not Medicare primary, but has a spouse or dependent who is Medicare eligible. In that situation, the subscriber would have the active employee or non-Medicare member options, which would be the 70/30 and the 80/20, while the Medicare eligible spouse or dependent would have the option of the Medicare Advantage plans. So now we're going to go into the 2020 open enrollment. Open enrollment this year will be held November 2nd through November 19th of this year. And elections made during this time frame will go into effect as of January 1st, 2020. It's very important to note that we do not have the full 30 days that we are normally accustomed to. We have, 17 days for open enrollment. So it is imperative that you let your employees know when open enrollment is going to take place this year. Not only that it has been pushed back from October to November, but they also need to know that it is shortened. This is going to be extremely important as open enrollment comes around, and I'll touch on that a little more in just a moment. So in terms of open enrollment each year, the state health plan holds that open enrollment period so employees can reevaluate their individual health care needs and for the upcoming benefit, which runs from January 1 to December 31st. Employees are allowed to enroll in the state health plan or switch between plans and add or remove dependents. They can even opt out of the plan if they would like to do so. Please note, though, that the member must remain on the health plan selected during open enrollment until the next open enrollment period, unless they experience a qualifying life event. So what we have here are the state health plan options for this year. We will continue to offer the same two plans for active employees and non-Medicare retirees for 2020. We have the 80-20 plan, in which members pay that 20% co-insurance for any eligible in-network services. Some services do apply to co-payments, and that would be perhaps specialist office visits or PCP office visits, urgent care, as well as emergency room or ER visits. Affordable Care Act or ACA preventive services that are performed by an in-network provider are covered at 100% at no cost to the member. So now in 2020, the 70-30 plan is basically going to mirror the 80-20 plan. Services are subject to deductible and a co-insurance maximum now. They're subject to a co-insurance maximum now. However, there will be an out-of-pocket maximum for 2020. Members will pay a 30% co-insurance for eligible in-network expenses. And just like the 80-20 plan, they will still have the co-payments for the ER, urgent care, and office visits. But what's new for the 70-30 plan in 2020 is that preventive services will no longer require a copay or be subject to the deductible and co-insurance. So, for example, procedures such as colonoscopies that are performed in an outpatient setting will now be covered at 100%. And as always, members on either plan or both plans may reduce their employee premium by completing the tobacco attestation for both of those plans, and they would save $60 on that employee premium. And I will go into that a little bit later. So what you see before you here is a chart that details the benefit changes for the 2020 plan year. In the first column of the 80-20 plan, it's highlighted in green there at the top. There are no changes. So that is how the 80-20 plan currently works for this current 2019 benefit year. And it is going to work the exact same way for the 2020 benefit year. Now, what's in the middle is how the current 2019 70-30 plan functions currently. But on the far right, you have the 2020 70-30 plan design. The changes have been highlighted in yellow. So you can see there have been some changes to the individual and family deductible, as well as the individual and family out-of-pocket maximum. It used to be a co-insurance maximum for medical and a out-of-pocket maximum for the pharmacy on the 70-30 plan. However, it's all combined this year into these out-of-pocket maximums that mirrors the 80-20 plan currently. Preventive services. It used to be that cost sharing would apply on the 70-30 plan. However, in 2020, there will be no cost sharing. Those preventive services will be covered at $0. PCP incentives. If you select a primary care physician on your ID card and you visit that primary care physician or someone else within that same practice who is designated as a primary care physician, you will pay a lower copayment on the 70/30 plan of $30. However, if you do not visit that primary care physician and you visit someone who is not listed on your card and not located within the practice that's listed on your card, then you will pay a higher copayment of $45. This is just like the 80/20 plan. Obviously, the only difference is the actual copayment amount. So now we're going to move down to the other changes to the 70/30 plan, which would include the pharmacy benefit. As you can see, tier 1 and tier 2 remain the same. However, tiers 3 through 6 have changed, and they are significant changes. It is extremely important to note that these are significant pharmacy benefit changes, especially for any individuals who are currently on the 70/30 and plan to remain on the 70/30. Another reason why this is significant is because if you have employees who do not take action during open enrollment, they will be defaulted to the 70/30 plan. So if you have someone who's on 80/20 right now, they want to remain on the 80/20, they need to go into eBenefits or call the Enrollment and Eligibility Support Center to keep that 80/20 plan and complete their tobacco attestation. As you can see here, Tier 3 and Tier 6 on the 70/30 plan for the 2020 benefit year will now apply to deductible and coinsurance. Tiers 4 and Tier 5, instead of it being a coinsurance up to a certain maximum amount, they are defined co-payments. Significant changes here, guys. Now, I will say that the formulary is updated quarterly. However, I would most definitely not base my plan decisions solely on medical. Definitely factor in the pharmacy as well, even though the formulary is updated quarterly. So essentially, the last formulary update was in July, I believe. The next one should be scheduled in October. So by the time you get ready to enroll in November, it will have recently been updated. But right after that, the next one will be sometime in January. Now, that doesn't mean that everything that's in the current formulary will change. There may be a few medications here and there that will change, in which it's extremely important that members review that formulary often, especially if their providers are prescribing them new medications or things of that nature. So this is a significant change, folks, and I think that employees should really take notice to this. Please do what you can to point out this change. So here we are again to more detail on the pharmacy benefits. Tier 3 and Tier 6, as I mentioned on the previous slide, they apply to deductible and coinsurance, which means they do not have a defined copay. Employees will have to pay full cost of the medication until they meet their deductible. So if you have any employees who are on the 70/30 plan, or any employees who don't take action during open enrollment and are defaulted to the 70/30 plan, their medications that generally fall into Tier 3 and Tier 6 will go from a coinsurance up to a maximum to being deductible and coinsurance. And you all saw what the deductible is on a couple of slides back there. Once the deductible has been met, they will be responsible for 20% of the coinsurance amount on the 80/20 plan, or 30% coinsurance amount on the 70/30 plan until they reach their out-of-pocket maximum. Medications that are subject to coinsurance in most cases will result in higher out-of-pocket costs to members, and this is again a significant change for 70/30 members. As a reminder, sometimes your prescriber or your doctor feels as though it is medically necessary for you to remain on a medication, even though it's non-covered. In that situation, that doctor can submit an exception through CVS Caremark to make sure that you remain on that prescribed medication or that excluded medication. In the event that your doctor submits a pharmacy exception request through CVS Caremark for an excluded drug and it is approved, please note that that approved medication will be covered at the Tier 3 and Tier 6 benefit level, which on both the 70/30 and the 80/20 plans in 2020 will be deductible and coinsurance. Again, a significant change. So please make sure that your employees are aware of this. Medicare retiree plan options. Medicare retirees will have the following plan options for 2019 and for 2020. That's the that's the base plan and enhanced plan. Both of those are Medicare Advantage plans, which are administered by United Healthcare. And then there's the 70/30 plan, which is administered by Blue Cross Blue Shield of North Carolina. This is very much like it was this year and a few years in the past. Please encourage your retirees and active employees who are 65 or older, who are considering retirement, to attend the plan's open enrollment Medicare outreach meetings that are going on this month and in October. My colleagues, Jane and Roberta, are extremely knowledgeable about Medicare enrollment, the open enrollment process. And during these outreach meetings, they are extremely hands-on. They take their time with their retirees or those who are considering retirement and get their questions asked. They have combined several years of experience in this, and they are a wealth of knowledge. So please encourage any employees that you know that are thinking about retirement, encourage them to go out and attend one of these meetings, outreach meetings. It's a good idea for you guys to attend these meetings as well, as you kind of get a better understanding of how this works and what retirees can expect as they approach retirement. So those dates and locations were posted to the state health plan website recently. If you go out to the home page, again, that's www.shp.nc.org. On the home page, there is the carousel that kind of changes there. It'll say open enrollment Medicare outreach meetings, and I think it switches between that and current open enrollment. Or you can click on the open enrollment section and then click retirees, and it'll take you to where you can register. So definitely encourage you to go, as well as anyone who's considering retirement. Something else that's important to note is that members are no longer able to edit or add Medicare information. It is up to them to call the Eligibility and Enrollment Center to have their to have it added or have their HBR to update it. So they may come to you and say, hey, I still had an old Medicare number, but I recently got the new Medicare number. Could you update that for me? Or when they become Medicare eligible, they'll just come to you and need that information input. So two options. They may call Eligibility and Enrollment or come to you. So in terms of action that needs to be taken during open enrollment, and this is something that I touched on a few slides back, all Medicare primary members will remain in the plan in which they are currently enrolled. So if you're on the United Healthcare base plan, you're going to stay on the base plan. If you're on the enhanced plan, you'll stay on the enhanced plan. Same goes for the 70/30 plan. However, if you are possibly a covered dependent are in a non-Medicare primary plan, which would be the 80/20 or the 70/30, then all non-Medicare primary members and dependents are being moved to the 70/30 plan for January 1, 2020, unless they take action during open enrollment to re-elect the 80/20 plan. So that's very important to remember. You may have a split family situation that we discussed just a few moments ago, where the subscriber is Medicare eligible and they are on let's say they're on one of the United Healthcare plans. However, they're carrying their children as dependents, and those dependents are on the 80/20 plan. Those dependents will be defaulted to the 70/30 plan if that subscriber doesn't take action, even though nothing will happen to that subscriber's plan. That subscriber will stay where they are, but their dependents will be moved. So that is extremely important for retirees to understand. So if the subscriber is non-Medicare and wishing to reduce their subscriber premium, they will want to be sure that they complete the tobacco attestation for 2020. And the same thing goes for their non-Medicare dependents. Action is required if you are not Medicare primary, is what this all boils down to. So even if, again, you are a Medicare primary subscriber, you need to make sure that your non-Medicare primary dependents are taken care of as well. So you still need to take action, essentially. So as I covered in a previous slide, we are pleased to announce that there are no changes to the co-payments or maximum out-of-pocket limits under the United Healthcare Group Medicare Advantage plans. However, as shown earlier in the presentation, there are changes to the deductible co-payments and maximum out-of-pocket limits for the 70/30 plan, which were explained on the previous slides. It's important to note that there have been some adjustments to the formulary with United Healthcare as well as Blue Cross Blue Shield. So again, please go out there and take a look at those formularies, that drug list. They are listed on the plan's website for your review. And I am not certain how often the United Healthcare formulary is updated. I would assume that it is quarterly, like these 70/30 and 80/20 plans, but I am not certain of that. That is something that I just so happen to think about that I will more than likely look into because I'm curious about it now. However, just be aware of those changes. There are no changes to the United Healthcare Medicare Advantage plans, but there are to the 70/30 plan. So just keep that in mind. And as always, remember that the open enrollment period is the member's opportunity to evaluate their plan options for coverage in 2020 and to make changes. If the member and their covered spouse or dependent are Medicare primary, their current plan will roll over for 2020 unless they take action during the open enrollment period. If the member is non-Medicare primary or have spouses or dependents who are covered that are non-Medicare primary and they want the 80/20 plan for the 2020 benefit year, they will need to take action during open enrollment. So something that is important to point out here is that you can enroll online. You would visit the state health plan website and click the e-benefits in the blue box. Then select the applicable gold box. There are multiple ways to get to this, guys, and it's pretty intuitive once you get to the plan's website. So you will see all the links as long as you click on the e-benefits link, or like this slide mentions, click e-benefits in this blue box. It will take you to the right place. And once you are there, you will see a series of gold boxes that will take you to where you need to be. Active employees typically would go through the access your benefits via e-benefits box. Retirees would go through Orbit. Then for us here who work in this building and any other Beacon employees, we would go through the Beacon system. You can enroll by phone, as I mentioned earlier. So during open enrollment, There will be extended hours for the Enrollment and Eligibility Call Center. They will be open Monday through Friday from 8 a.m. to 10 p.m., Saturdays from 8 a.m. to 5 p.m., and Sundays from 12 p.m. to 5 p.m. It may be a better idea to call on the weekends because that weekday call volume may be a tad bit heavier than it will be on the weekends. During this 17-day open enrollment period, there are 3 Saturdays and 3 Sundays. Please encourage your employees not to wait until the last minute. Do not wait until that 11th hour. It is going to be a headache. They're going to get frustrated. Call volumes are predicted to be heavy. They are predicted to be heavy. So I would not recommend running out on your lunch break and trying to run errands or pay bills or go shopping or whatever you're doing and talking on the phone trying to make that enrollment because your call wait may be extensive. So just keep that in mind. I would also recommend that your employees do not, or retirees for that matter, do not get frustrated at the wait time and hang up. Do not hang up and call somewhere else to complain that the wait time is long, because at that point, you'll have to start from scratch when you call back, and you'll be even more frustrated because your 30-minute wait changed to 45 within that time that you hung up to call somewhere else and complain. So just keep that in mind as well. Call volumes are going to be astronomical. So just keep that in mind, and weekends may be the better option for making that phone call. So now, a bit of important information to share. Disability. If a member becomes eligible for Medicare as a result of a qualifying disability, they may be awarded Medicare retroactively. It is important to accept the Medicare offer and to not overlook accepting the offer to make Medicare Part B retroactive as well. The state health plan will become secondary to Medicare as of the Medicare eligibility date, and claims will be adjusted back to the Medicare eligibility date. So that is the importance of picking up that Part B retroactively when you've been awarded Medicare due to a qualifying disability. If the member fails to obtain Medicare coverage, they will be held responsible for what Medicare would have paid on their claims. And guys, you all know, if this eligibility is due to a qualifying disability, there very well could be numerous claims involved. And the last thing that we want is for our members to experience financial hardships because they did not make that Medicare Part B retroactive when they had the opportunity to do so. So it's extremely important that those who are eligible due to disability get that Part B. Read that award notice carefully because the state health plan will become secondary, Medicare will become primary, and those claims will be adjusted retroactively to apply Phantom B. So what we have here is a slide about important address information, P.O. boxes. If you have a member that is currently only has a P.O. box on file with the state health plan, they need to provide a physical address as well. The reason being is that United Healthcare cannot process an enrollment with only a P.O. box on file. Our system is able to store multiple addresses, so you don't have to get rid of your P.O. box. That just needs to be stored as your mailing address, while the physical address will be stored separately for Medicare purposes. So please make sure that you go through Orbit or your employing unit or by calling Eligibility and Enrollment Support Center to make sure that we have the physical address as well as the mailing address. I have seen an instance where a retiree was kicked off of her United Healthcare plan and she couldn't understand why. So she gave us a call and she inquired about it. And after doing some research, I found out this was totally unbeknownst to me. I didn't even know that this was a thing. I found out that that was the reason why, because she didn't have a physical address on file. And if United Healthcare basically disenrolls you, you will be auto-enrolled into the 70/30 plan. But you will have the opportunity to get that all straightened out once you add your physical address. I'm not sure if she had to wait until open enrollment, the next open enrollment, to get that changed. But if you really want the United Healthcare plan upon retirement, you definitely need to make sure that you have that physical address on file as well. And that, ladies and gentlemen, is the end of our presentation. We will begin to take questions. So allow me just a moment to pull these questions up. Okay, so Doug, I see some questions for you. Let's see here. All right, so the first question is, can you explain how a retiree determined which Medicare plan to select, or even if one needs to be selected? That is going to be based on that individual's preferences. We definitely cannot advise which plan that an individual needs to take. That is going to be solely up to the discretion of that member. Something that I have always suggested is that you do some homework. It's not an easy decision, and you want to make the most informed decision. The plan does a good job of sending out plan comparisons when you become Medicare eligible, as well as during open enrollment. So a plan comparison basically will have all three Medicare primary options side by side on a chart that details each benefit side by side there, so you can compare those. In addition to reviewing that plan comparison, I would recommend writing out what prescriptions you have, what medications you take regularly, what doctor visits you have regularly. So if you're seeing a specialist or a cardiologist for your heart, write down how many times you see that cardiologist. Write down how many times you see your endocrinologist. Things of that nature, things that you know you're going to have throughout the year. Write all of that stuff down and use that information in conjunction with the comparisons chart to figure out what you could be facing in out-of-pocket costs for those services. Like I said, including your medication. So utilize the formulary to determine what, even though the formularies do update, but use the information that is available to you at that point to determine how much you'll be spending on your medications. What you should also factor into that equation is your premiums, the plan premiums for those plan options that you have. So you're going to have to do a little bit of math, do a little bit of work, depending on how extensive your medications and provider services are, you may benefit from putting it in a table, a Word document, an Excel spreadsheet, or what have you. But I would suggest doing that and then making the best informed decision. I hope that answers your question. Let's see here. How does a supplemental hospital insurance, non-Medicare, that an employee has while they are working and continues coverage when they retire help with health coverage and or affect their health coverage with the state health plan and or the Medicare Parts A and B? So I need a little more clarification on that. A supplemental hospital insurance and you put non-Medicare. Typically, when I think of a supplement, I think Medicare supplements, and those kind of pick up what is left over after the other plans. So I need a little more information there. So could you provide a little more information? I'm not fully understanding your question. Is there a period of time where if you make changes in your 2019 state health plan, those changes will automatically carry forward to the 2020 plan year? No. All changes for 2019 will be for the 2019 plan year. However, if you're making those changes online, or if you call the Enrollment and Eligibility Center, you will need to specify that. Please specify that you are making changes for 2019, especially if those changes are during the open enrollment period. So there is a workflow to go through open enrollment that shows the screens that are available. And I covered those during the HBR open enrollment training yesterday. So whenever you go in to do a QLE or to do open enrollment, you have to select a reason for your change. If you're doing a QLE, that will be for the current benefit year. That will be for 2019. If you select the open enrollment reason, that will be for the next benefit year for the 2020 plan year. So any changes that you make in 19 will be for 2019 unless it's during open enrollment and you select the qualifying life event reason. Now, I will say this, now that I'm talking about it, if you go in and change your PCP for 2019, that will carry over into 2020. That is probably one of the only things that I can think of that if you change in 2019, that it will carry over to 2020. But other than that, any changes for this year has to be done in this year, and any changes for 2020 must be done during open enrollment. Otherwise, you would have to wait until January 1 to make those changes. And I do have a suggestion here, probably for that previous question about the supplements and things of that nature. It would be a good idea to have that retiree to contact SHIP. You can access their contact information from the DOI website, or you can just Google SHIP, and it's spelled SHIIP. It's 2 I's. And they have volunteer counselors to assist retirees. That is a great suggestion. Thank you so much, Margot. I appreciate it. So yes, SHIP is a wealth of resources for retirees, especially those who are entering the realm of Medicare and they're being inundated by all this mail and people knocking on their door and they're just not sure what to do next or where to go. So SHIP is a valuable resource. I would recommend having the retiree to do that, to reach out to them. How is more than one plan order determined? If the retiree has Medicare and 70/30 and another employer retiree plan that was established before retiring from the state of North Carolina, what is the order for claims to go through? That is called coordination of benefits. And Blue Cross Blue Shield would determine the proper coordination of benefits in a scenario like this. There are coordination of benefits rules that they go by. If they are a retiree, Medicare is going to be primary. I can say that Medicare will be primary. The 70/30 plan, being that that's a retiree plan, and the other employer retiree plan that was established before retiring from the state, that would be up to Blue Cross Blue Shield and the other retiree plan to agree on. They'll need to agree on which rule they're going to follow. And I believe it would be a rule surrounding which plan was in place the longest, but I could be wrong there. I know there are multiple rules that they go by. Well, it's not multiple, it's a handful of rules that they go by in determining coordination of benefits so claims are paid properly. Every so often, there is a situation where there's some confusion where, let's say, Blue Cross think they should be primary over the other plan, or the other plan thinks that they should be primary over Blue Cross, and that ends up being just a claims nightmare where nobody's paying but Medicare. So in those situations, that is when the retiree, if the retiree is starting to notice that nobody's paying anything, it would be a good idea to contact Blue Cross Blue Shield of North Carolina and have one of their representatives to straighten it out. They will work directly with the other retiree plan to figure out what order the coordination of benefits should be in. I hope that answers your question there. Pulling up the next question. She elaborated on her question. The supplemental health plan is a cafeteria benefit elected supplemental health plan. I'm going to be perfectly honest with you, Tracy. I am not familiar with those plans at all. I'll be more than happy to research it for you and get back to you. I do apologize. I'm not familiar with those plans. If employees have declined coverage in 2019, will it automatically decline coverage for 2020, or do they have to log in to decline coverage again? That is a fantastic question. They will need to log in and decline coverage for 2020. This active enrollment basically is a way to make sure that all employees reevaluate their health care needs. So if you've declined coverage in the past, you will be auto-enrolled into the 70/30 unless you log in and decline coverage again. So please make sure that your employees who have declined state health plan coverage do know that they should log in to say, hey, I don't want it again for 2020. Great question. Will new employees during open enrollment period be automatically enrolled in the 2020 plan year? New employees during the open enrollment period will need to elect for both benefits. So when they come in during open enrollment period, they will need to elect their benefits for the remainder of 2019, and they will also need to elect their benefits for 2020. When they go in, they should see the prompts for both years. So therefore, they would need to complete everything for both years, including the tobacco attestation. So they will need to answer that question for both benefit years. And I'm sorry, Jennifer, I see that you weren't able to hear me. Did you hear my answer to the question about declining coverage? Just in case you did not, if you have employees that declined coverage in 2019, they will need to log in during open enrollment to decline coverage for 2020. Perfect. Great. Those are all the questions I have. Does anyone else have any other questions? And Tracy, I am making a note to research your question and get back to you. We still have plenty of time, folks. All right. Well, if we don't have any other questions, I do want to thank you all for logging in and attending this webinar today. I hope that you found it to be informative. However, if you do think of any other questions that I may, of topics that I may not have covered during today's presentation, please feel free to send an email to hbrinquiries@nctreasurer.com. And myself or one of my colleagues will research and answer your questions for you. Thank you so much.